Good morning, everyone. Good morning. My camera looks a little bit blurry this morning. So we're going to look at how to use topical progesterone in this video. Since my podcast interview with Dr. Platts a couple of weeks ago on progesterone, a lot of people have been reaching out to me about progesterone. A lot of people have purchased it, and not just Dr. Platts one. There are other options too. But along with that, I did a video on my YouTube channel kind of summarizing progesterone. I am going to do a video on, which I feel will be easier for people, a short video on a list of symptoms of low progesterone. So that will be coming shortly. But in this one, how do we use topical progesterone? So I think those of us who listened to the interview, and if you've been following my posts and recommendations, topical progesterone is the most efficacious bioavailable form of progesterone, because when it is applied topically to the skin or dermis, it gets absorbed straight into the bloodstream, so it doesn't need to be metabolized by the liver. And once it goes into the bloodstream, then it's more readily available to attach to the progesterone receptors, which are all over the body, attached to all the cells, which seems to not happen with the likes of prometrium. So that's why a lot of, not just myself and Dr. Platt, a lot of health practitioners, functional medicine practitioners, integrative practitioners, naturopaths will recommend topical, especially when it comes to progesterone. But how do you use it? There's a couple of ways. Good morning, Krista. So there are a couple of ways. I have my preferred way, but then there is the recommendations that are on the bottle as well. So we'll touch on both of them. So generally, it is dependent on the individual, and I'll usually speak to a client or follower will reach out to me and say, okay, this has arrived, how do I apply it? And if I know the client or the person, I will be able to then recommend dosaging. If I don't, I'll ask a couple of questions just to get an idea of how much dose to start them on. So some people will just start on one dosage, and when we say one dosage of this one, that's just one pump, and one pump's quite a lot. It's about a teaspoon. But a lot of my clients who I know what's going on with them, I'm generally starting them on 2 pumps a day. And how we will split that up is we'll do it once in the morning and then once again before bedtime. And what we're doing with 1 pump is we're splitting that into 4 parts. And 1 part we're going to put here, just behind the ear, on this bone here, on your cranium, and we're going to just massage down your neck, all around this area. Those of you that suffer from migraines, you might want to go back a little bit more into the back of your neck. And we're going to do that on each side. So 1 part on each side. Then the other 2 parts we're going to put on the inside of your wrist there, yeah, iodine, but on the inside of your wrist where you can see like my veins on my bone, right there where the skin is very thin, and it's very easy for whatever is applied to this area will get absorbed very fast and effectively. So you're going to apply 1 part there, and you're going to just rub it around, and then on the other wrist. So that's your 4 parts that come out of 1 pump. You do that in the morning. I generally do when I'm like doing my makeup, getting ready for the day. And then in the evening, I will do it in my evening routine. I'll put a hairband on so I don't get any hair caught in cream. And everyone is going to experience it differently, but it's important to recognize that it does take, and it is individual, but on average it takes 3 days for the progesterone to load in your body. So 3 to 4 days in order for you to really start seeing it with the sleep and the bowel movements and the bloating aspect and even the menstrual cycle aspect. For many people, as soon as they apply it, they start to feel kind of that calmness, and ability to deal with stress or whatever life throws at them immediately. So that's effective that way. There are some people though, and if you look at the instructions, it says use 1 to 3 minutes before meals, or as recommended by your practitioner, who would be me. But for some people who have blood sugar imbalances, there's some insulin resistance, there's some blood sugar imbalances going on there, they're going to apply progesterone, and that's going to interact with their blood sugars, because progesterone does influence blood sugars and insulin. And this could go either way. Some people will feel wired and jittery like they would with caffeine, because of course caffeine interacts with blood sugars and insulin as well in some people, not everyone. So in these people they may get the jitters, but in other people they'll apply the progesterone and it'll pull their blood sugars down. And they're going to just feel very tired. You know, if you have a carb meal or some sugar and you feel very tired or lethargic after it, like all of a sudden you're like, oh man, I'm exhausted, because it's pulled your blood sugars down and you've got that insulin response happening. And for some people that will happen when they apply progesterone. In that case, so in the first case with the jitters, that's where we would be using it around food. That is the best, and especially if you're having carbs at your meal, that's where you would use it there. And maybe even half a pump, like reduce the dose, or you could do half a pump earlier in the day at that meal and the other half before bed. In those that do get that pull of the blood sugars and feel tired when they use progesterone, in that case I'm just starting them really in that evening routine where they can go to sleep and just relax then. But I'm also making sure that they have enough food during the day, especially their carbs, to help support the blood sugars. And that should itself, so I have one client that I'm thinking of, and right now we are working on her blood sugars. And she's coming a long way, but she used progesterone yesterday and it made her tired, which I expected because we've only been working on her blood sugars for a week. So in that case, I'm like, okay, well, we're going to use this at night, but we're going to make sure you have enough carbs during the day. And I also want you to just have, like, I've given her some tips to have by her bedside should she have any blood sugar issues at night. But in her case, because we're already working on improving everything, I expect this to normalize within a few days, and then she's not going to have any influence per se on her blood sugars from the progesterone cream, because we're already working on that. So I hope that makes sense. So of course there's an individual aspect. You'll only know when you try it how it affects you or how you feel. For me, I have very good blood sugars. If you saw my post yesterday, I recently started wearing a continuous blood glucose monitor. So in general, my blood sugars are great. They really only get influenced with stress, which is everywhere, but otherwise they're great. So progesterone does not influence my blood sugars at all. And that's really where we want to see everyone at eventually. But I'm using progesterone to help with my stress resiliency, hence the glucose monitor, the progesterone, everything. Like, I'm doing everything now to try help to balance my hormones and my stress response. But also I'm using the progesterone before bed. I sleep great, but when I'm stressed, I have that adrenaline response and it can interrupt with me getting into that deep sleep, and I can't afford that. And I'm too young for that to happen, so I'm using the progesterone to help me just have these rock solid sleeps, and it's awesome for that. So I suppose that's kind of the be all and end all of it. It's pretty straightforward on how to use it. It's perfectly safe. I am considering using it on my little boy because he's been having some anxiety at bedtime. So I'm going to try that out and I'll let you guys know if it's helpful or not. I do have a client who used it on her daughter, her husband, and on her dog inside the dog's ears, and she said like immediately you could see a difference. I have considered trying it on my cat because he's a bit of a nut job, but I don't know if he would stay still long enough for me to get it into his ears. A lot of benefits to progesterone. It is very, very safe. but we can kind of play around with the dosages and the application to see what works for you. So I hope you found this video helpful. If you do have any questions, just leave it in the comments and I will respond to them as soon as possible. Otherwise, enjoy your day and I'll chat to you guys soon. Bye.